PCOS patients have got lots of follicles and despite that they are not ovulating. So what is the reason behind it? It is hormones and hormones that I have already explained, but that was a Hindi video. So let me re-explain it in the English video for my English speaking audience. Hello friends. Today we shall understand that why PCOS is associated with infertility and how these ladies who have got PCOS can conceive. So first and foremost, they have got irregular period, and this irregular period is caused by irregular ovulation that they suffer. So why this happens? What happens is that there is a hormone which is called follicle stimulating hormone or FSH, which is secreted by the brain, and that acts on the follicles in the ovaries. Under the influence of the follicle stimulating hormone, out of the millions of follicles which are present in the ovary, one starts getting bigger in size in each cycle. Each cycle means every month. It starts growing from a microscopic cells into a cell which is called ovum, which is up to the size of 2 to 2.5 centimeters. So it reaches because of FSH. In a lady who doesn't have got PCOD, usually one such follicle is recruited. And that produces a hormone which is called estrogen. So what happens is that once that one particular healthy follicle has been selected for that particular month, which has been recruited that it will become the egg for the cycle, it starts producing a hormone called estrogen, which sends a signal to the brain that now there is no further need of follicle stimulating hormone in that particular cycle, and the follicle stimulation stops, and that healthy egg grows, and then there is ovulation. And if some lady has sex during the time of ovulation, she will conceive. If she doesn't have sex, she will have a regular period. But those who have got PCOD, they have got plenty of follicles. So rather than one follicle, there are multiple number of follicles which are recruited every cycle, and while they are still quite small, all of them are producing hormones, and collectively these small follicles produce the same amount of estrogen as a single healthy follicle would have produced in somebody who doesn't have PCOD. So because of that increased level of estrogen which is coming for so many small multiple follicles, the brain gets the signal that it doesn't need to produce FSH any further. And when there is no further FSH, the egg production stops at the small level and there is no ovulation, which leads to infertility as well as irregular periods. So now when we know what is the mechanism, obviously we need to find out that how we can help it here. So first and foremost is again lifestyle. If in case a lady loses even 5% of her body weight, it has been found that they start producing eggs by themselves. The ovulation starts happening by itself, and that happens because, as I've explained in my other videos, that fat is the site where excess of estrogen as well as testosterone is being produced, and it also causes insulin resistance, and all these hormonal disbalance lead to an ovulation. So weight loss, fat loss, and that leads to ovulation by itself. Now suppose somebody is trying lifestyle changes, and despite that the periods are irregular. It can happen. It doesn't mean that the PCOD lady is lazy or she is not putting her effort. But still, despite all the efforts, if somebody is not producing egg spontaneously, then we need to take help of certain medicine. One of them is metformin. Metformin is a medicine which decreases the insulin resistance in the body of the female, and because of the decreased insulin resistance, there is some amount of weight loss. It is not a weight losing medicine, but it decreases insulin resistance, and thus the resulting weight loss can sometimes lead to egg production. And so many ladies, they say that they conceive just by taking metformin, and that can happen. But if in case that metformin is not helping, then we need to do ovulation induction, which means that we need to give certain medicine which will help the ovaries in reaching, not the ovaries, the follicles from the ovary in reaching that particular size which is needed for a healthy ovum to be released from the ovary, which is more than 20 millimeter or more than 2 centimeters. So the first group of medicine is which is called clomiphene citrate, which is being you since years altogether. And how does clomiphene citrate works? Without making it too technical, I will tell you clomiphene is an anti-estrogen medicine. So by being anti-estrogen, it is suppressing the amount of estrogen in the body, and because of the suppressed estrogen, the follicle stimulating hormones start producing. Because as I explained earlier, it is the amount of excess estrogen which is making the follicle stimulating hormone to stop being secreted from the brain. So when a clomiphene citrate is taken, it acts anti-estrogenic, and the FSH continues growing till the level that one of the follicle or more than one of the follicle is recruited, and that produces the egg for that particular cycle. Another group of medicine is called letrozole. Letrozole are aromatase inhibitors, and they also act in a way that they create a situation where the body gets a signal that there is less of estrogen in the body, and again FSH keeps on being produced by the body, and under the influence of the follicle stimulating hormones, the follicles grow, and which leads to ovulation. If even these two medicines don't work, if letrozole or clomiphene don't work and a lady is not producing egg despite that, then what can be done? Then in that case, we can inject the follicle stimulating hormone, which is also called gonadotropin, externally, and it can be given till a particular certain amount of follicles, they start growing. One of the follicle becomes the dominant follicle for that particular cycle. It grows and it causes ovulation. So FSH is the third medication, or rather fourth medication, which can be used if the oral ones have not worked. Apart from that, we can do IUI, which is called intrauterine insemination, in which the gonadotropin or FSH can be used to stimulate the egg, and at the same time IUI is done where the sperm of the partner of the lady that is washed and put directly in the vaginal tract of the female, and that increases the chances of conception from 10% to 18 to 20% chances of conception per cycle. And if it doesn't work, in that case one can opt for IVF. IVF is similar to what I've told you, that one needs to get FSH, the follicle stimulating hormone. So that is given, and then lots of follicles are produced, and that is extracted from out of the body of the female, and that is mixed with the sperm of the lady's partner, and that is put back in the uterus, the embryo which is produced because of the fusion of or fertilization of egg and sperm, and that has got a success rate of 30 to 35%. Now these females who have got PCOD, they are at increased risk of ovarian hyperstimulation syndrome because they have got lots of follicles. So when we are giving either clomiphene or letrozole, or we are giving the FSH stimulating hormone or luteinizing hormone, all these, they act on so many extra follicles which are present in their body, and rather than one, there can be so many follicles which can be recruited in one particular cycle, which can not just lead to multiple pregnancy or twin pregnancy or triplets or quadruplets, but also this ovarian hyperstimulation syndrome, which can be quite dangerous for the life of the lady if it is not done properly by the doctor who is treating the fertility of the PCOS patient. But having said that, I have told this, but the picture is not so gloomy. Majority of the PCOS patients, they conceive by themselves just by lifestyle changes or by oral medication, metformin, clomiphene and letrozole. But if that doesn't work, then as I told you, then one can be given follicle stimulating hormone. If still that doesn't work, then IVF is there, which is not 100% thing, but at least it increases your chances of conception, and one has to take care of ovarian hyperstimulation syndrome, which is obviously not what you will do, your doctor will do, and there is increased risk of having multiple pregnancies. So that is all about the fertility aspect of PCOS. I hope that you found the video useful. If you wish me to cover any other aspect of the disease, do let me know, and I will be more than happy to get back to you on that. Till we meet next time, have a great week ahead. Bye bye.